Judy Taglia. I'm the Chief Operating Officer, Chief Executive Officer, excuse me, Nancy, of Central Vermont Medical Center. And I'm pleased to be standing here today with Dr. Brumsted of Fletcher Allen and Governor Shumlin to officially announce and celebrate the affiliation of Central Vermont Medical Center with our neighbors at Fletcher Allen Healthcare, the state's academic medical center. This affiliation marks a step in the development of the very first coordinated healthcare system in Vermont that will improve care and reduce costs for Vermonters. Central Vermont and Fletcher Allen have long enjoyed a close relationship, and we are now taking our relationship to a whole new level with this affiliation. We are creating a parent corporation called Fletcher Allen Partners, with governing powers over both Fletcher Allen and CVMC, which will become subsidiaries of the new parent organization. So what does this mean? It means that there will be greater clinical and financial integration with this affiliation and the opportunity to make best use of our collective resources for the benefit of our patients. Each medical center will remain separate with its own medical staff, workforce, and management structure and board, but the parent board, Fletcher Allen Partners, will facilitate regional strategic planning, coordinated delivery of care to patients, and centralized administrative services. Some of this collaborative work has already begun. For example, we are already collaborating to determine how our ICUs can work together to ensure that these patients are treated locally whenever possible and transferred to Fletcher Allen when more special care is needed. Another example is that CVMC will be joining Fletcher Allen's information system. It's called Epic Prism. And CVMC information system so that everyone at both medical centers will have access to the same electronic medical record. Another example of work that's begun is that Fletcher Allen and CVMC have identified opportunities to combine service and supply contracts for the two organizations to save hundreds of thousands of dollars in the coming year. So there's a lot of exciting, productive collaboration already going on, and there's a lot more to come. Before I turn over the microphone to Dr. Brumsted, I just want to add, in my former position as a CEO of a hospital in Maine, I was part of an integrated delivery system that included several hospitals and worked very well. So I have some experience with this, and I've seen it work, and I think it can work here as well. At this point, I'd like to introduce to you Dr. John Brumsted, who's the interim president and CEO of Fletcher Allen.
Thank you very much, Judy. I don't need this, do I, since I've got the other mics here? Okay. Thank you. On behalf of Fletcher Allen, I want to say that our academic medical center is very pleased to be affiliating with Central Vermont Medical Center. There's been a great deal of collegiality and collaboration over the past 9 months as we've prepared to implement the affiliation, and we're very pleased that this has come to fruition. As Judy said, this affiliation marks a significant step in developing a coordinated healthcare delivery system in Vermont that will deliver high-quality care for Vermonters and do it more efficiently, that is, add greater value. Delivering high-quality, low-cost care requires a high degree of collaboration among providers. Working together, our two medical centers have the ability to deliver more coordinated care for patients and to deliver that care more efficiently. As the state's academic medical center, we have a desire to work in concert with our neighboring hospitals to coordinate the care for patients we serve together. It's also important to note that the affiliation will foster our academic mission. With an integrated healthcare system, we have an opportunity to train the next generations of physicians, nurses, and other providers in a clinical environment of the future, one that emphasizes coordination and integration, and to provide expanded opportunities for clinical and health systems research. As a physician who's been practicing medicine in the state of Vermont at Fletcher Allen for 30 years, I'm very optimistic and extremely excited about the opportunities that lie ahead of us. This affiliation is the right thing to do for our patients and for the region. It's been very gratifying to us that Judy, as president of CVMC, has been interested and willing to partner with us in this new affiliation. We see this as an ultimate win-win for everybody involved, for CVMC, for Fletcher Allen, for those that come to us to study and learn, and most importantly, for the patients we serve in Vermont and in areas beyond our borders. And now I'd like to turn this over to Governor Shumlin.
Thank you so much, and I'm here to both congratulate and commend the leaders of Central Vermont and Fletcher Allen, Judy Tarr and John Brumsted, and the board of directors of both institutions for their vision in this affiliation. We all know that in Vermont, we must find ways to deliver quality health care to all Vermonters and spend less money while we do it. That the rising cost of health care is not sustainable. It's killing employers, it's kicking the middle class who are struggling economically in the teeth, and we know that we can find ways to deliver quality care to Vermonters for less money. That's what this affiliation holds the promise to contribute to. Two extraordinary healthcare delivery systems. Central Vermont and Fletcher Allen are both integral to delivering quality care to Vermonters. They've come together and said, by affiliating, we think we can find ways to improve the delivery of care, to use the strength of each other's institutions, and do so in a way that costs less money. This is exactly what we're going to be looking for as we approach significant reform for our healthcare delivery system. And when this kind of initiative comes from the board of directors and from the institutions themselves, Vermonters win. So I congratulate your vision, your courage, your willingness to put aside the turf battles and come together for the best interests of the health care of all Vermonters. So congratulations to all of you.
Open it up for questions?
Yes, we'd be happy to take questions.
Now this time around, you do have to stand next to each other because it's a ride.
Keith McGilbert from Channel 3. I know we spoke a little bit earlier today, something that I forgot to ask. Often cost-saving measures come from eliminating positions. Do you anticipate either eliminating or adding positions as a result of this partnership, and if so, how many?
We are not looking at either adding positions or eliminating positions right now. A lot of the savings that we've talked about coming initially come from things like supply chain savings and the efficiencies that come from eliminating duplication of tests and those sorts of things.
There are any elimination of positions are likely to come through attrition over a longer period of time.
Thanks.
Questions? Other questions?
Has any money exchanged hands, or will the new partnership? Who will own the infrastructure here? Is there any transfer of property or?
There's no transfer of property. Fletcher Allen Partners will not have a building and actually does not have any employees. The work of Fletcher Allen Partners will be done by the employees of Central Vermont Medical Center and Fletcher Allen Healthcare, working in collaboration on specific projects.
Is this going to become a model for other healthcare institutions in the state?
Scott, we hope so. Yeah, I think what we have is the beginnings of the development of a true integrated healthcare delivery system here in Vermont, which is something that I believe is needed now and was probably needed years and years ago. So this is the start of that.
I would just add emphasis to that. I believe exactly the same, that this is a starting place, not an endpoint for integrated delivery systems in this region.
So how will the finances work exactly? Will the money that will you integrate your financing, or how will that work?
Right now, it is not contemplated that there will be integration of the financing. The parent, Fletcher Allen Partners, does have approval over budgets, capital budgets, large capital projects, strategic planning. So the Fletcher Allen Partners can influence significantly what happens at Central Vermont Medical Center and Fletcher Allen Healthcare, but those two organizations remain corporations with their own finances, their own bottom lines, their own budgets.
Will things look any different for patients going into the medical center?
Yeah, I think there'll be some real advantages to patients over a period of time. And one advantage that is my favorite is the common IT platform. We'll be converting to Fletcher Allen's PRISM Epic software program over the next couple of years. And that will provide a single medical record for any patient who is a patient of Central Vermont or Fletcher Allen or one of its physicians. So that has a huge amount of opportunity for savings and to improve patient safety throughout the system, and just a better vehicle for our doctors and nurses to communicate with each other through one IT platform.
Any idea what it will cost to integrate the EMRs?
It's pretty expensive. We're working on that now.
Just want to make the point that one of the opportunities for reducing healthcare costs and delivering quality care to Vermonters is just the example that was cited by Dr. Brumsted. Integrated IT systems where we actually know when you go to the provider's office who treated you beforehand, what they prescribed, and everything that's happened to you medically before you got to that provider. And there's a huge savings in assuring that that information is available to the provider to serve you.
Plus, we didn't, I'm sorry to interrupt you, Governor.
Take it away. I'm used to that.
I've never done that before. So I think in terms of savings too, where our goal would be to eliminate or reduce considerably the number of duplicate testing that goes on now, simply because we're not on the same electronic platform.
But Judy, when you say pretty expensive, are you saying, I don't necessarily need an exact number, but hundreds of thousands of dollars, millions of dollars?
The cost has to do with the purchase of the software itself. And that's probably going to be a CON that Central Vermont files, I would say in the next 3 months or so, to begin the process. But the software itself is millions of dollars. The payback is over a longer period of time.
One of the great opportunities of the federal health care bill, and the reason that we're piggybacking on that bill, is that if it's funded, it promises to bring hundreds of millions of dollars to Vermont providers for affiliations like this, to be able to invest in the IT so that the vision that was just outlined can be delivered on without it having to come out of the pockets entirely of the providers like Central Vermont and Fletcher Allen, who are already struggling with rising costs. So there's the potential for federal help here in what they call the federal health care bill.
When we talk about what the patient's perception might be and talk about savings, as a clinician, I really think that that comes together on having a true integrated delivery system where all of the providers across whatever that patient needs have had conversations, and so you know what's supposed to happen, when it's supposed to happen, and where it's supposed to happen. And you do that in a standardized fashion. And even with people with the best intentions, that rarely happens unless you have organizations that are tightly affiliated, like we're talking about between Fletcher Allen and CVMC, to have the clinicians have those crucial conversations up front. And the patients then perceive, wow, this is really slick. Everybody knows what's supposed to happen when. And you really drive tremendous amounts of waste out of the system, the waste that just comes with people moving sometimes relatively aimlessly through the medical system, and I see a lot of nodding heads here. That's what we're all about, minimizing or eliminating.
Could you talk about the tests that you said are redundant and how much there might be in savings there?
I don't know how much there is in savings, but usually we're talking about X-ray x-ray tests, lab tests, certain cardiology tests, I think are often repeated. There's a couple of physicians in the room that can probably speak. Dr. Brad Watson is president of our medical staff. Dr. Steve Leffler is the president of Fletcher Allen Medical Staff. They could probably answer that question better than myself.
Come on up here, though, because
Yeah.
I know how this works. They're gonna yell at me, so I'm not gonna start. They got a narrow range on these lenses, so come right in. That's right. I know it's scary, right? They won't. I'm so glad it's you and not me.
So I'm an emergency physician at Fletcher Allen, besides being the medical staff president, and I'll say that it's quite frequent that a patient will come from even a local office, not come with an EKG or some lab testing, and we're forced to repeat it because we don't have the information right now. A common medical record where the information flows right into the computer that I'm looking at with the patient there will be much more efficient, and it happens on multiple patients on a daily basis. So I think the savings are quite significant.
Well said.
You know, I think the other thing that we've talked about how this may improve sort of communications, at least in this central Vermont, at least this part of the state. But the other thing that needs to be talked about also is the local improvement of care. And Fletcher Allen is really, this affiliation is really allowing us to be a medical center and to treat our local patients here instead of having to transfer. And there may be some efficiencies that way where it's less expensive to take care of patients in your local community hospital. And Fletcher Allen certainly has allowed us to, with their clinical support, to be a medical center, and we look forward to building on that.
Did staff at either hospital have reservations about this partnership, or were you excited about it, and what were your thoughts on a merger have been?
That was
Dr. Watson?
Dr. Brad Watson.
I missed that question.
I was just curious if staff at either hospital had reservations about this partnership.
I think always when you have a small community hospital, I think we're the third largest hospital behind Rutland and obviously Fletcher Allen. The staff really don't want to lose local control. There's cultural differences between a large academic medical center and a smaller community hospital like ourselves. So I think that was clearly a talking point when we first started talking about affiliation. I think that the word affiliation describes, you know, we're sharing resources, but we're also separate. We have separate board of trustees, separate medical staffs, separate CEOs. So I think there's still many ways to preserve the local flavor and culture of our institution.
It is worth mentioning that the academic partnership here is something worth promoting and commending too, since we have the name, our only research university at the University of Vermont, Fletcher Allen affiliation. It's a huge help to Central Vermont to be able to be a part of that affiliation and train doctors and providers who are ready to face the challenges of our healthcare system. Thank you.
Thank you all very much.
Hi, Ann. How are you?
Good, how are you?
Good.
How's life?
It's the same. Changes all the time.
You must be working really hard.
This little